My name's Carson Pettingill. I'm a Master of Social Work intern at Grand Canyon University, and I work at TheraPeace Counseling. I have a few therapists in my family that have been very good role models for me, and kind of just like paved the path for me into therapy. And I think the reason why I wanted to be a therapist also is because I had my own journey in therapy, which was very like life changing for me and had a very big impact on my life. And I think I'd be a very different person today if I hadn't gone to therapy when I was younger. And so it really did shape my life. And I think because of my own personal experience, I feel very drawn to the field. I think that empathy, validation, presence, and attunement are the basics that all therapists should have, because I think that that really guides the practice. I think the goal of like therapy is like you want your client to trust you. Like I want my client to be able to trust me, and I think through the use of validation, empathy, presence, and attunement, I'm able to gain that trust. I work with a wide range of individuals, but I think a particular focus of mine would be the LGBTQIA plus community. I'm a member of the LGBTQIA plus community, and I grew up in a very Mormon environment where it wasn't necessarily accepted, and I encountered a lot of situations where I didn't feel safe being who I was. I feel like I was always putting on a mask, that I couldn't really be my authentic self. And I think through therapy, I was able to find acceptance around my identity, and find comfort around my identity. And, through therapy, I was also able to integrate myself into communities that did accept me. And I think without therapy, I wouldn't have been able to do that. I also love working with individuals who have experienced trauma, just because that's where most of my training has been in so far. Helping people understand their trauma, helping people grow through their trauma, heal from their trauma, be desensitized to their trauma, is so rewarding, because you can see the change even in their affect over time, like throughout therapy. The thing about trauma is it totally changes our brain. It changes how we perceive things. It changes how we understand things. And we see this in our everyday experiences. You can understand how this traumatic experience that happened before might affect the way that they are navigating their relationships, might affect the way that they're navigating some complex situations throughout their like everyday life. And talking about those experiences and how they're managing those experiences is primarily what we're doing during the first, few sessions or the first few months before we jump into reprocessing. And I think that's when we incorporate those stabilization exercises. Like when someone experiences something that's very triggering or something that, activates like fight or flight, like using modalities like dialectical behavioral therapy to feel grounded and to feel like present when those trauma responses arise. I think the stigma around therapy, specifically for men and other vulnerable groups, is very concerning in society. How receiving mental health help is very looked down upon. And I think that, the first thing that comes to mind when I think of that is that like you matter and you deserve a space where you can heal from these experiences. Like you deserve to process these experiences that are, concerning to you or have created a lot of conflict in your life. Like you deserve a space to heal from trauma. You deserve a space to have your feelings heard. I think like coming to therapy is so hard. I think setting up the first appointment is so hard. I think that there's a lot of fear and maybe even anxiety around coming to therapy. And my advice is do it. Like it is so rewarding and it is so important, especially if we are dealing with things that are affecting our everyday life, whether it's intense anxiety, whether it's navigating a complex relationship. Therapy can help you really understand yourself and also help you learn from your experiences and grow from your experiences. And I also emphasize that like the first step is the hardest. And once we get past that first step is when we have the opportunity to grow and to heal.